Hi, I'm Dr. Marcelo Cypel, and I'm the director of the Toronto Lung Transplant Program. In celebration of 30 years of transplants, triumphs, and transformations, I'm here to share with you my professional and personal story of my relationship with Astellas Pharma Canada and the partnership collaboration within UAGN Ajmera Transplant Center. The impact of Astellas Pharma Canada on my life has been both professional and personal. I came to Toronto as an international trainee in 2005, and I served as a research fellow in lung transplantation in the thoracic surgery lab, and I stayed there until 2008. It was around that time, in 2005, that the Michael Tremblay Innovation Research Competition was launched and funded by Astellas Pharma Canada, working collaboratively with Dr. Gary Levy, who was at the time the founding director of the multi-organ transplant at UAGN. We were very fortunate to submit to this application and be awarded for the next consecutive 5 years. This funding greatly helped us to carry our ex vivo lung perfusion experiments, which made major impacts in the field in the subsequent years. On a personal note, Astellas Canada played an important role over my first years as a research fellow in the lab. At that time, I was seeking for some research salary support, and as an international medical graduate, it was difficult to find that in Canada. I then applied to several agencies without much success until CHR opened a competition for a fellowship, which was industry partnered, and Astellas was kind enough to be one of the industry partners in the application. Eventually, we got those funds, which were then paid to the thoracic surgery lab, and was able to support my time for the next 2 years in the lab. And so I think together with the Michael Tremblay Innovation Funds that we're able to carry on the experiments, I think this fellowship really helped a lot moving things along for the ex vivo lung perfusion research. From 2006 to 2008, we did very important breakthrough experiments in ex vivo lung perfusion. Our biggest goal at that time was to keep an ex vivo lung for 12 hours stable, so we could then apply therapies such as gene modification of donor organs. This was a radical change in the way organ preservation was maintained at that time, which was basically cold static preservation. And so we set up those experiments in a way that we could move to proof of concept clinical trials in the subsequent years. So up to that point, no one was able to achieve this. And so in 2008, we started a clinical trial assessing lungs that were otherwise not suitable for transplantation, and they will go through ex vivo lung perfusion. And eventually we transplanted 20 patients using organs that otherwise would not be suitable for transplantation. The results for the patients was excellent. And so this really paved the way for many more transplants in the subsequent years. We published this study in the New England Journal of Medicine in 2011. Since then, we have achieved 1,000 ex vivo lung perfusions, and currently we perform about 120 procedures per year, and this has actually doubled the number of lung transplants we can carry on a yearly basis. It's amazing to reflect in the past and look into the future, what can be done with this technology. Up to now, we have been able to double the number of lung transplants we can perform by utilizing not only 20% of the donors, but actually utilizing 40% of the lung offers to us. However, there's still a lot of room to increase the utilization of donor lungs for transplantation, and we're working on strategies to fix these organs and make them suitable for transplantation. However, the more exciting piece is how can we actually modify these organs in a way that the patients do better after transplantation? I'd like to congratulate Astellas for 30 years of success in transplantation and all your support for our research programs. You're making really a big difference in the life of transplant patients. And we very much look forward for future collaboration within the next 30 years.